So this is absolutely a trick question. VIP, it's the last step of the protocol, and it is notoriously difficult to access, not just outside of the US, but in the US, it can be hard to find a pharmacy. It can be difficult to travel with it. It has to be refrigerated. There are a lot of difficulties around VIP, but I imagine on an international scale, it's just so much more difficult. So how do you address that step of the protocol?
It's actually, I would say, the most difficult part, like you kind of alluded to in that question. It is available at some compounding pharmacies, but obviously you need there's only a kind of a handful of doctors that are, let's say, willing. I think everybody's able to, but most doctors don't even know that it exists. They don't really know what to write on the prescription, even if they were willing for the compounding. And it's really expensive. I've also had many clients who don't tolerate it well because of their liver issues or the lipase situation that happens. I personally had the lipase elevation that Dr. Shoemaker talks about, where you then kind of can't take it. I had to take it at a 1/100th of a dose or something like that to tolerate it. Some people don't tolerate it at all. So, it's a really difficult one because you don't have that same, well, not as far as I'm aware. Hopefully some stuff pops up in the future, but you don't have that same thing as you do with binders, where even though they're not as effective, there are alternatives. VIP kind of, I feel like it sits in its own little space. Yeah, it's a difficult one. I have been using a homeopathic tincture that a naturopathic doctor in the US has kind of created, just because it's homeopathic, and I thought it's well tolerated. There had been good results, so I thought I'll give it a try. I am actually having good results from a symptom perspective, but it's too early to know whether it's actually shifting the blood markers, right, or the brain scans, which is obviously the gold standard that you want to achieve, if at all possible. But again, I think if it's not possible and you have no other option, then symptom resolution is still a good result, right? So often what I'm finding is the mood issues will shift. People seem to have kind of less anxiety, more motivation, and that's really helpful for continued treatment, right, and getting through the rest of the protocol. So I'll be doing more testing, like as we move through, to see if it's actually shifting the blood levels or not. But that's kind of a watch this space. But otherwise, it's yeah, I'd love to to find some alternatives in that space. It is definitely the most difficult. Luckily, not everybody needs it. Like everybody needs binders, right? So at least it's only a portion of the CIRS population, but still a very necessary one in many cases.